I am invited to give a presentation about water supply materials and the need for a common approach for the harmonization of health-related requirements. Some history about the development of the European Acceptance Scheme. The development was initiated by the European Commission under the Construction Products Directive and the Water Drinking Directive. There was a whole process with a feasibility study, a joint research program, and a mandate 136 to CEN to develop supporting test standards and product standards. There was a Commission decision on the certification level that for products in contact with drinking water, the certification level should be on the highest level. And in the end, this process led to a proposal for a European acceptance scheme for products in contact with drinking water. There was a broad support for this proposal by the regulators, the industry, and the drinking water industry because of the given transparency, the protection for human health, and the removal of barriers to trade. However, the feasibility was questioned by the European Commission. One of the reasons was the legal framework. Should it be done under the Construction Products Directive or the Drinking Water Directive or other legislation? And also the required resources were questions for an operational management. In the meanwhile, because there was no EAS, member states, UK, France, Germany, and the Netherlands started to work together to harmonize their national systems and to support DG Enterprise with guidance for the standardization work. This cooperation was formalized by a declaration of intent, and we are working on the development of common principles based on the EAS proposal and the national schemes, and we are also working on the maintenance of common building blocks like positive list. So, a common approach, is it necessary? We think it would be good because we are with 28 member states dealing with two European legislation, a directive and a regulation, and 28 systems is not efficient to deal with this issue. There are transnational aspects and clear benefits for harmonization within the EU, and in the end it would lead to better products for a sustainable drinking water supply.
We have this HBB scheme, and there we look for all emitted substances and assess the toxicological relevance of all detected single substances and see whether they are harmless or relevant, whether they are carcinogens. We compare these with the LCI values, which is a kind of threshold value where concern could arise. But we also limit the unaccessible substances as a precautionary principle, and we limit the total amount. But as you saw before, the total amount doesn't tell so much. Well, we started, together with the French and Danish and Finnish, we had started an initiative to harmonize the labeling. In 2007, I think we began. There are publications about it. But we realized that the most important thing is to have the LCI harmonized. So, and we had a 2 years approach now, so supported by ISPRA. But then the mandate ended, and we have started this list to be harmonized. We have 70 substances already in a harmonized manner, but there is no funding anymore and no commission who feels responsible for it. So it is a similar problem. And so DG Enterprise would say, no, this is Sanko, and Sanko has other problems than this. So we are, for the time being, we are without mandate, but we need one. And we had made, not to stop all this commitment of the group, we have arranged a 7th meeting now with the funding of UBA, but the next meeting, we still want to continue. The group is really good, and we will probably meet next year in Paris. Mandatory and voluntary emissions tests and control is effective in triggering low emission products, and hazardous substances can be excluded. But for health protection of European consumers and for simplifying orientation of manufacturer, a harmonization and evaluation with EU LCI and labeling needs to be tackled. We need a mandate, at least, to show that we are working for a common interest. And the costs are low, so I would, if there is somebody from the Commission here with open ears, I would ask for their support. We have also already written a letter. Our ministry has written a letter last November for support of this need of a harmonized list, but there was no answer yet.
As my colleague already said, many chemicals are used in the production of textiles, and there are many steps and processes from fiber to finished product where chemicals are involved. For example, there was a report from 2010 from a Swedish research institute where it was concluded that on average 3 kilograms of chemicals are used to produce 1 kilo of t-shirts. So you have different processes here, and for example in the dyeing and finishing step you often add chemicals to have a certain function on the final product, such as colorants, prints, flame retardants on upholstery materials. You have perfluorinated compounds, which are used to have oil, soil, and water resistance. And there are also antibacterial substances used in order to avoid odor, for example, on sport clothes. And then we had an evaluation of the risks of hazardous chemicals to textiles. And this was just done in a qualitative manner, since there were so many chemicals. We also did a legislative proposal for a regulation at EU level, and an impact assessment. So we ended up with 165 chemicals with the most hazardous criteria, which is CMR1, certain allergens, skin and respiratory sensitization substances, the most environmental hazardous substances, aquatic chronic 1. And in addition to that, there were 24 substances on the candidate list which were not included in this classification. And these are really the most hazardous substances. We didn't, for example, include CMR2 or other allergens, for example.
We wanted the suggestion to result in a unified regulation at EU level to effectively target hazardous chemicals in textiles, and which are placed on the market in the EU then, so that the content of hazardous chemicals for consumer will be limited based on intrinsic properties. So our two main regulatory options was expanding the fiber labeling regulation or using the existing REACH regulation. So what we found out was that if we would expand the fiber labeling regulation, it would fulfill all the three options presented in the picture earlier. And it's possible to regulate on intrinsic properties in the regulation, and it also already deals with textile questions. But the stakeholders that we asked was not so positive to this idea, since this is a labeling regulation, and our intention is to regulate chemicals, not to label content of hazardous substances in textiles. The other option is REACH, and we found out that REACH is not so suitable for regulating large amounts of chemicals. And the regulation has also a risk-based approach and not intrinsic properties. It is also a very complicated and time-consuming process for restricting new substances. So using REACH as it works today, it would likely take decades or hundreds of years to accomplish our objective. So another idea that came up was to have a separate chapter in REACH for just dealing with articles.
But our assignment was a bit short, and we think it's really further assessment is really needed for other options, such as eco-design directive or other options. And we also think that textiles should be part of the EU strategy for a non-toxic environment in the 7th Environmental Action Programme. So this was already mentioned today. That's all, I think. Thank you.
We have heard now quite a number of examples, water, indoor air emissions, textiles, where public authorities are making a clear case for EU action and EU initiatives, and that will be interesting to carry them forward after lunch into further product groups and further presentations we have.